Hello, this is Dr. David Greene with PreferredPainCenter.com, where we bring you anything and everything education for pain management. Today the topic is the facts on narcotic prescription drug abuse. Now the word narcotic and opioids in this video I'm going to use interchangeably, so just keep that in mind. Narcotic abuse today is at an all-time high, and the CDC refers to it as an epidemic, and it is an epidemic, really. Every 14 minutes in the United States, there is a fatal prescription drug overdose. Keep that in mind, every 14 minutes. Narcotic prescription drug fatality overdoses, right now there are about 20 to 25,000 annually in the United States. Recent studies have shown that for every narcotic fatality overdose, there are 30 times more people who overdose non-fatally and end up in an emergency room. So think about that. That means there are over 600,000 narcotic overdoses every year where someone doesn't die but ends up in an emergency room getting their stomach pumped or something like that. I mean, that's crazy. That is unbelievable. Between 2000 and 2010, narcotic prescriptions in the United States more than quadrupled. So more than fourfold prescriptions being written every year. The number one prescribed drug in the United States right now, Vicodin, which is Hydrocodone, is the generic. A University of Michigan study showed that by the time students reach the 12th grade, about 10% of them have tried Vicodin. Now, 10% have not sustained an injury or have chronic pain that needs Vicodin, so a decent amount of high school students are trying it for non-medical reasons. Hospitals, physicians, and pharmacies in 2010 dispensed over 42 tons of pure hydrocodone and over 69 tons of pure oxycodone. You know how many truckloads that is? I mean, 69 tons is almost 140,000 pounds of drugs. The latest statistics show that physicians write about 300 million opioid prescriptions every year. Considering that there are about 300 million adults in the United States and then about 30 million kids or so, that is unbelievable. That's like one prescription for every adult in the country. So it really is amazing. Back in the 1990s, there was a big push, and it started in the VA system, to look at pain as the fifth vital sign. Okay? And then from 2000 to 2010 was the decade of pain control Congress was pushing forward. So things have come, to almost like a tipping point where it's not out of control, but it's getting there. I mean, epidemic is the appropriate word. So when you look at a pain management practice such as Arizona Pain Specialist, they're doing it about as safe as anybody can possibly do. They have a 12-step compliance program, which includes numerous things: physical exams on each visit, documenting how the pain medications are working, opioid agreements, urine drug screens, checking the pharmacy database, all of the things that they can possibly do. Now, you can't live with somebody and tell them not to take more than they're supposed to, but there are certain things that a physician can do to be as safe as absolutely possible, right? So that's where things are. In addition, Arizona Pain also has all kinds of interventional pain treatments, such as epidural injections, facet blocks. They have chiropractic treatment, physical rehabilitation, acupuncture, behavioral therapy. It's the comprehensive, customized care that allows medication management to usually decrease as opposed to needing elevations of dosages. Check out our website at PreferredPainCenter.com. You can find all kinds of information there on medication management and all kinds of pain conditions. The number to call is 602-507-6550. I'm Dr. David Greene with PreferredPainCenter.com. Your pain stops here.